Nasal obstruction is when you can't breathe through your nose, and that can occur for a number of different reasons. One of the top reasons is a deviated septum, where their septum is curved from one side or the other and it blocks the airflow through the nose. Another condition that can happen is this thing called turbinate hypertrophy, where the inside of your nose has swelling and you just can't breathe really well through it because of all the congestion. It can happen from allergies or from other triggers. Another common cause that we see in our office is this condition called nasal valve collapse, and that's when the sides of the nose can collapse in when you're breathing in. Some people will use Breathe Right strips to try and help them to sleep better at night, but there's a procedure that we can utilize to try and treat for that. Typically, it's this procedure called lateral implant, where we can place an implant into the nasal cavity. It doesn't change the shape of the nose, but it provides an internal Breathe Right strip to allow you to get better breathing through the nose. If you're not a candidate for that, then treating the septum with a septoplasty or doing a turbinate reduction can also help to better improve the breathing through your nasal apparatus. Eustachian tube dysfunction is when you have a sensation of blockage in your ear. And this typically occurs when the tube that connects the ear to the back of the nose gets clogged. That can occur when you have symptoms such as, or conditions such as allergic rhinitis, but sometimes the muscles in the ear aren't working as well as we want them to. The symptoms that you feel are similar to when you're on an airplane and you feel like your ears get clogged and they don't open up completely, and you can have that cloggy sensation that can last for a long period of time. Typically that can be treated with a number of different techniques, either medical management with things such as nasal steroid sprays. You can also consider surgical intervention such as a Eustachian tube balloon dilation. This is when you utilize a balloon that goes right into the nasal cavity and opens up the ear from the inside to allow for more space for it to drain. So for sinusitis, typically that is characterized as either acute or chronic condition. Typically for an acute infection that happens when you have something similar to a cold, you get congestion, headaches, facial pain, low-grade fever, but it lasts longer than a week. Typically when we see it's not responding, which is natural remedies, we consider things such as antibiotics, nasal steroid spray, saline irrigation to see if that will clear it up. Typically, if it doesn't resolve within about 3 months, then it goes from being an acute infection to being a chronic infection. And for chronic infections, we manage it similar to the acute infection, but if it doesn't respond to that, then we would consider things such as surgical intervention. Balloon sinuplasty is one option. You can also go to a hospital or a surgery center to get treatment as well. Balloon sinuplasty is when we take a rubber catheter and we inflate it into the nose for a few seconds. It doesn't stay in the nose. Typically it's used to make the sinus passageways that are narrow more open. We typically say a patient is a candidate for that when they have chronic symptoms such as headaches, pain in their face, pain in their cheeks, tooth pain that doesn't respond to the traditional techniques of nasal sprays, saline irrigations, or antibiotics. And we'll utilize this technique so that we can kind of allow their sinuses to drain more appropriately. For the balloon sinuplasty procedure, the expectations before is that you're going to be receiving a phone call from our surgery coordinator. During that phone call, she's going to call you and give you the specific dates for the surgery itself, as well as a preoperative visit and a postoperative visit. During the preoperative visit, we go through a lot of the details of the procedure, such as when to take certain medications to help to keep you sedated or sleepy for the actual procedure itself. We also go through instructions such as how to do the postoperative care. Some of the postoperative care techniques can include utilizing a nasal saline irrigation to keep the sinuses clean and flowing well. We understand that for the first 6 weeks after the procedure, the sinuses may not flow as well as we want them to. So we have you rinsing your nose at least once a day during that time frame, more frequently at the beginning. Typically, other things that we recommend is an Afrin nasal spray, which is a nasal spray that helps with congestion and bleeding that can be very minimal but can occur within the few days of the procedure, and it helps to kind of ease these symptoms. After that, we give you other instructions such as using things like a pillow to help to elevate your head, to decrease congestion, and other little tips that kind of help our patients get more comfortable during that healing period. The other things that we typically will tell you to do is to stay away from any super duper strenuous activity for about 2 weeks. No heavy lifting or doing any marathon running, but you can get back to your normal daily activity within 24 hours. Typically people can go back to work within a day or so. So many times your physician or your doctor may tell you to do this technique called a saline irrigation. And for many people, that's foreign to them. So I wanted to explain to you today what exactly that entails so that we can go through it and you can do it successfully when you're at home. Typically, you can use different products. This is NeilMed saline irrigation, but there are a number of different vendors that you could use. The technique is similar. What you would do is basically fill it with water to the black line or just above. You want to put a salt packet that has been pre-mixed right into the bottle, and then you mix it up. Typically, the type of water we recommend that you use is distilled water. If you have to use tap water, make sure that you boil it and then allow it to cool. After you've had an opportunity to kind of get it successfully mixed, then you put it into your nose, first on the right side, then on the left, and you alternate until the entire bottle is empty. And typically we do this to try and get a successful and effective flush. We're using the saline flush to try and clear out things such as allergens and other irritants, so it can be done daily. You can also use it for acute conditions such as sinusitis to keep the nose clear. When you're using this, we typically tell you to say ka, 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 and it helps to kind of close off the passageway for the ears as well as for the throat, and it allows it to kind of stay directed to the other side of your nose that you're not rinsing. So you continue to go back and forth saying ka, 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 until the bottle is completely empty, and then we know you've done a successful rinse and your sinuses are clear. People will also use this after sinus surgery, and it helps to kind of allow them to heal a little bit faster.